Prof, a very good evening to you. Thank you for your time. So I want us to begin with your assessment of the manner in which government has handled issues over the past 24 hours. Is this exactly how it's supposed to flow?
Good evening, Timbekile, and thank you for having me on the show. Yes, I think government is doing pretty well. They're doing the best that they can under the circumstances. Remember, even though this virus has been around for about 3 or 4 months now, it is still a novel or a new coronavirus, and we're pretty much learning new things about this virus every day. In fact, a few times a day we're getting new information about this virus. So governments can react based on what they know, and based on what we know currently on this coronavirus, government is doing well, I think.
And when you look at this as a professional in this space, what are the key focus areas that you think every South African, every business, every government official and minister should be aware of as we proceed?
I think probably the most important thing to be aware of is to prevent panic. I think there is huge panic in the general population, and that panic is pretty much linked, I think, to, number one, misinformation and not understanding what is happening currently. As you mentioned, I worked in Singapore in 2003 on the SARS coronavirus. And what I see playing out now in South Africa and worldwide is exactly what we experienced back then in Southeast Asia. Lack of information, not understanding this new pathogen that we see in the human population now, and all of this really leads to mass panic in the general population. So I think that probably one of the most important things that government and various sectors, including the education sector, could do is really educate the population and sharing vetted, correct, proper information.
And just in terms of the virus itself, we know it's highly infectious, not necessarily as highly fatal. That also leaves open the space for people who are likely to slip through the net, if you will, undetected, and perhaps not even know that what is actually wrong with them is more than just the common cold. How big of a reality is that?
So keep in mind, as you mentioned, many other pathogens could cause very similar symptoms. And then obviously we would have patients that are infected with COVID-19 but that are asymptomatic, so they do not present with symptoms. Very often these patients would not be infective to others. So I know of one case study where somebody that was asymptomatic was infective to others, but this is very unusual and this still has to be confirmed. And remember, as you mentioned, we have just over 100,000 people infected worldwide, and about 3,500 people fatalities. So that's 3.5%. Is this number, mortality rate, the kill rate, really 3.5%? Remember, the 100,000 that we know of are confirmed cases. So these were people who were ill enough to go to hospital to be tested. What about those who never became ill enough, that never went to hospital? What of those that are asymptomatic? So the number of positives are probably much higher, which means that the death toll, the death percentage would probably be lower in the end. So it would be interesting to see how this plays out and how the numbers actually add up in the end.
And Professor Fielding, we've spent a lot of time from January discussing just the comparison between the fatality rate, the number of infections, but what is not coming up in a lot of conversations, for example, is the recovery rate. When you look at the Johns Hopkins University tracker, upward of 55,000 people are said to have fully recovered.
Exactly. So if you look at a mortality rate of 3.5%, worst case scenario, that means that 96.5% of those infected who went to hospital, who were tested and who were positive, recovered. 96.5% is a huge number recovering. So it is very obvious that even though any death is always a sad occurrence, that the mortality rate for this is not very high. 3.5%, and in certain cases, yes, it does seem higher, especially if you look at the demographics in terms of age and gender, and the comorbidities, meaning patients with other illnesses. So across, but the average of 3.5%, it's really not that high if you consider the actual number that's infected, that we know of. What of those that we do not know of, that were infected but never presented to hospital?
A lot of parents were worried in KwaZulu-Natal this morning because of the parents of the man who's become the first coronavirus case in the country being a classmate of their children going to the same school. But globally, I understand that there are fewer instances of children testing positive for COVID-19, and the fatality rate as well is much lower than in adults. How come?
So that's a very good question. This is exactly the same question we asked in 2003 with SARS, with the SARS coronavirus. In fact, in response to the outbreak, schools across Southeast Asia shut for about a month, only to reopen after a month because we had exactly the same occurrence that we see now. Kids, much lower infection rate, kids, much lower mortality rate. We still do not have the answer for that, but it's exactly what we saw with SARS coronavirus in 2003.
So would you say then that parents especially need to remain calm in school environments and the like?
Exactly. And that's why when I started, I said, I think the number one thing that we need to remember is to stay calm. Keep in mind that currently the highest death rate is amongst males, older males, and then males with comorbidities, which means they have other diseases.
Are there specific diseases, Prof? Forgive me for cutting you off. Are there specific diseases that we should look out for in terms of the compromised immune system and the like?
So currently we know of high blood pressure, we know of diabetes, and we know of heart disease. Those are the three ones that we currently know of.
All right, last question. Self-quarantine, self-isolation, I know has come up a lot in the conversation. I'm wondering about the keeping of the environment sterile during self-quarantine and post. How do we go about doing that in our personal space?
So remember that we do not know how long this virus remains active on surfaces. I would speculate probably about 24 hours, slightly longer. So it is using disinfectants. The most effective way of preventing spread is disinfecting surfaces, but then also good personal hygiene to prevent spread from person to person. So during self-quarantine, it means isolating yourselves from others and then disinfecting with a good disinfectant your surrounding area where you are self-quarantined.
Professor Bertram Fielding with the University of the Western Cape, Director of Research there. Thank you so much for your time on Nightline tonight.